Epidemiological Studies. Hello, everyone. Today, we're diving into the fascinating world of epidemiological studies. These studies are essential tools for understanding health and disease patterns in populations, and they're primarily divided into two categories: observational and interventional studies. Let's explore the key differences between them and how they are designed. Firstly, in intervention studies, the researcher actively assigns the exposure to participants. This deliberate allocation allows for a controlled investigation into the effects of specific interventions. Think of it as a controlled experiment where the researcher decides who gets the treatment and who doesn't. On the other hand, in observational studies, the exposure occurs naturally among the participants without any intervention from the researcher. The researcher simply observes and records the natural course of events, either currently or retrospectively. Observational studies can be further classified into descriptive and analytical studies. Descriptive studies aim to describe the participants' characteristics without comparing different groups. They simply tell us what's happening within a particular group at a specific point in time. Analytical studies compare different groups to examine relationships between exposures and outcomes, helping us understand the connections and potential causes. Within intervention studies, there are several types. Non-randomized intervention study. The researcher decides who receives a given exposure. Randomized intervention study. Random chance determines who receives the intervention. Control intervention study. The exposure or intervention is compared against a placebo. Randomized control trials often provide the highest quality of evidence. However, observational studies are more common due to their simplicity, ease of implementation, and lower cost. If an observational study includes a comparison between groups, it's considered analytical. If it only describes participant characteristics, it's descriptive. Observational studies can be divided into cross-sectional, cohort, case control, ecological, and case series studies. Now let's talk about cross-sectional studies, a common type of observational study. These studies are typically conducted through surveys like the National Health and Nutrition Examination Survey, NCHANES, in many countries. The goal here is to select participants who represent the whole population, allowing for generalization of the findings. Cross-sectional studies are relatively simple in design and often serve as initial investigations into potential causes of ill health. They can be either descriptive or analytical. And how are they designed? First, choose the target population you are interested in. Then, take a sample of participants who represent that population. If it is an analytical cross-sectional study, you gather data on exposure and the event simultaneously and calculate prevalence ratios based on exposure and event frequencies. If this is a descriptive cross-sectional study, you will only describe the frequencies of exposure, event, or other characteristic. There is also a variation of cross-sectional studies that analyze the performance of diagnostic tests. The only difference is that the exposure is the diagnostic test, and the event is the actual status of the participant's health. Key features of cross-sectional studies. Participants are selected based on representativeness, not their specific histories or behaviors. For instance, in a study conducted in Goa, all 16 to 24-year-olds from 2 rural and 2 urban communities were invited to participate, achieving a 95% participation rate. Of the 662 participants, 3.9% reported smoking behavior in the past 3 months. To avoid selection bias, participants should be unaware of their exposure or disease status. Data on outcomes, such as smoking, and exposures, such as gender, education, and alcohol consumption, are collected simultaneously, making it difficult to determine causality, reverse causality. Challenges in cross-sectional studies. Reverse causality. It's challenging to determine whether the exposure leads to the outcome or vice versa. For example, does being overweight reduce lung cancer risk, or does lung cancer lead to weight loss? Survival bias. These studies evaluate prevalent cases of disease present during the survey. Advantages of cross-sectional studies. They are useful for examining exposures that do not change over time, e.g., gender, blood group, or occurred long ago. In this context, the issue of time directionality is less problematic for factors like gender preceding smoking behavior. However, More complex issues, like school attendance, require careful consideration. Generalizability. The results of cross-sectional studies are based on specific populations, such as young people from certain rural and urban communities in the GOA study, which may affect the generalizability of the findings. Diagnostic studies. Lastly, let's touch on diagnostic studies. These studies focus on collecting data from diagnostic test results or physical examinations rather than interviews or questionnaires. In diagnostic studies, individuals with disease symptoms are selected randomly or consecutively from clinics or hospitals to undergo the test of interest, known as the index test. Process of diagnostic studies. Independently and without knowledge of the index test results, the same participants undergo the best available diagnostic test, referred to as the reference test or gold standard. The results of both tests are compared to determine the accuracy of the index test, assessing its sensitivity and specificity.